Thank you very much, John, and thank you for the opportunity for me to come and speak to you this morning about an area which my research team and I are very much enjoying working in and are quite passionate about. Yes, my area of research and teaching is that of exercise, and I've spent the last 23 years doing little else. And what I find is most astounding, even today, after that time you think you get burnt out, but I still find amazing the benefits that we can derive from appropriate physical activity. I'm going to show you a list now of just some of the diseases and chronic conditions that exercise has been shown to be extremely effective at not only prevention, but once you have the disease, of helping you to manage that disease and to recover. And they include arthritis, insomnia, obstructive pulmonary disease, renal failure, heart failure, coronary artery disease. We now know from some very good work coming out of Sydney that physical exercise is very effective in the treatment of depression. Our group in WA at Edith Cowan University is now doing a lot of work in Alzheimer's and showing that lifestyle has a big impact on slowing the progression of Alzheimer's. Physical exercise, very effective. Obesity, a growing problem. Sarcopenia, which is the loss of muscle as we get old. Osteoporosis, peripheral vascular disease, and type 2 diabetes. Very, very effective. I lost my dad to prostate cancer. So I have a very personal interest in discovering how his experience could have been improved. He didn't die of the cancer itself. He died in part due to the treatments, the decline that he went through with the treatment, the cognitive decline that accompanied the androgen deprivation therapy that he went through, the fatigue that he experienced, his reduction in social interaction, and in particular, he stopped all forms of physical activity. And it was then, as an exercise scientist, that I truly saw the decline in his physical cognitive function, which ultimately led to him moving into nursing care, then limited entirely to bed rest, and soon after that he passed away, not from prostate cancer, but from the decline that occurred from the changes in his lifestyle and the treatments of that cancer. So my colleagues and I launched on a literature review to try and see what is the effect of exercise with cancer. And we published this paper in 2005 in the Journal of Clinical Oncology. And we could only find at that time 26 published studies which looked at either pre or post intervention with regard to cancer. 18 were during the cancer treatment, and various mixes of intervention there, whether they were cardiovascular, which is like walking and jogging, flexibility training, and only 2 studies that we could find involving resistance training. Yes, folks, lifting weights for cancer patients. 8 of them were after the cancer treatment. Once again, cardiovascular training predominates with some resistance training and flexibility exercise. A range of cancers were addressed, but 12 of the 26 studies were exclusively breast cancer, and 5 were a mix of breast and others. The remainder were non-breast cancer. As an exercise physiologist, I found the exercise programs in many cases to be quite poorly designed, of too low a intensity, and despite that, outstanding results from those studies, absolutely outstanding. Let's have a look at some of the general increases that exercise can produce in a cancer study. Muscle and bone mass increased. Cardiorespiratory fitness increased. Your maximum walk distance increased. Immune function. People's ability to fight the disease and the treatment is actually enhanced through physical exercise. Physical function, which I saw particularly in my father decline, if you are physically active, that decline is slowed and even reversed. We have in some studies seen that people actually reach a level of physical function which was greater than before they had the disease. Flexibility, muscle strength, quality of life, and hemoglobin, the measure of oxygen carrying capacity in the blood, all increased. What sort of decreases can you see? Nausea, very commonly reported, particularly associated with chemotherapy. It is actually reduced if you become or increase your physical activity. Body fat reduced. We see many cancer patients that through the various treatments, particularly hormonal interventions, that they put on a lot of body fat. And this greatly increases their risk of developing other chronic diseases such as cardiovascular disease. We want to minimise any fat gain. Exercise is very effective for that. One of the most commonly reported symptoms of cancer and its treatment is this overwhelming fatigue. Physical exercise actually reduces that fatigue. It seems incongruous. You think you should rest when you're fatigued. In fact, I'll show you some of our research that we've been conducting. The opposite is in fact true. We need to get physically active to reduce the fatigue. Symptom experience overall is reduced. Duration of hospitalisation greatly reduced. Resting and exercise heart rate and also blood pressure can be brought down with exercise during cancer treatment. On the psychological side, we see that the emotional stress associated with the fear of dying and all other aspects going with the cancer diagnosis and treatment are reduced. Depression and anxiety are reduced if the person remains physically active or actually increases their physical activity. So we thought, gee, this is encouraging. If we were to design an intervention with the best knowledge we know of exercise physiology, using some of the exercise interventions that we would normally apply to healthy individuals. In fact, we use many of the principles that we apply to our top-level athletes. What could be the effects of that? The first research project we embarked on with the cancer population was to actually track some men receiving androgen deprivation therapy over a 36-week period. Androgen deprivation therapy is normally a pharmaceutical intervention which brings the level of testosterone in the man down to practically zero. Previous research had shown some catastrophic effects of that intervention. We wanted to quantify that more exactly, and what we found was decreases in lean mass, that's your muscle and bone, of up to 5.6% over that 36 weeks. What we also found in these men was a 21% increase in fat mass. Now this is not only increases their risk of other diseases like type 2 diabetes, but of course it also makes the fatigue that much harder when you have to carry around this extra body fat. We found considerable reductions in bone mineral density. The therapy actually forces them into an osteoporotic state. And you see some of the decreases in bone density, the strength of their bones, by up to 4% over a relatively short period of 36 weeks. Physical activity levels decreased, their levels of fatigue went up, and what we have now is a double whammy, if you like, where their muscle strength is reduced, their bone fragility is increased, so if they are more likely to fall, and if they fall, they are more likely to fracture. If they fracture a hip, they are unlikely to survive 12 months. Not because of the cancer, but because of the treatment and the side effects that go with it. We've been doing a lot of work of late in breast cancer trying to get understanding of this overwhelming fatigue that occurs. And we initially thought that it was a physiological mechanism with regard to the cancer and its treatments. We were disproved. Our hypothesis was totally inaccurate. What we found was that over the course of treatment, the women in our study greatly reduced their level of physical activity. Their body fat went up, their muscle tissue went down, and their overall fitness, if you like, was greatly reduced. And so the fatigue is more a factor of their deconditioning. It's like any of us who went on who greatly reduced our activity, who spent much more time in bed or in a seated position doing no exercise at all. Your fatigue level goes up, simply as a deconditioning effect, not due to the cancer or its treatment. So with this evidence in hand, with these two patient groups, we launched on an intervention study. It was a 20-week resistance training study in men on androgen deprivation therapy for prostate cancer. 20 weeks is not terribly long for an exercise intervention, but even in that time, we found improvements of muscle strength of between 20 and 40%, muscle endurance of 50 to 100%, walking ability increased over 20%, stair climb ability over 8%, chair rise, the ability to get up from a chair, improved 21%. So very real functional improvements in these people. We also found that their dynamic balance improved. So they have a reduced risk of falling. And in this patient population, that is a grave concern because they tend to be older men. And we found that the resistance training, the lifting of weights, over that 20-week period, greatly improved their balance. We also found that they had no loss of bone or muscle over that time, over that 20 weeks. And yet our prior research showed considerable losses in both those critical tissues, and we were able to prevent that. So this leads me to a few recommendations in terms of physical activity. I think the first thing in terms of cancer populations is that we have to totally reject this absolute rest strategy. We know it's a difficult time. We know that you feel fatigued. But what we need to do is be proactive. Total rest will only exacerbate the symptoms and the side effects of treatment. We must reverse our concept of gentle exercise. Don't place our cancer patients in cotton wool. Walking, housework, gardening are a much less efficient stimulus to the body's recovery as are a proper exercise program. But by all means, don't give up these activities. What we're suggesting is that you need to look at increasing your physical activity, and as I'll show you, particularly with regard to resistance training, the lifting of weights. So here's some recommendations that we were asked to put together, some recommendations by the Cancer Council of Western Australia, which has been put into a set of guidelines to be distributed out to various cancer care and hospitals. Based on current knowledge, we would recommend aerobic exercise, so that's your sort of huffy-puffy type exercise. You choose whatever you like. It can be walking, rowing, cycling, jogging, swimming. 3 to 5 days per week for 20 to 60 continuous minutes, and it must be at a moderate intensity level. This is 60 to 90% of your heart rate max. Now, heart rate maximum can be calculated as 220 minus your age. Now, 60 to 90% is a fairly high level of that. And this is a take-home message. It has to be of a reasonable intensity. We also are recommending resistance exercise. What has been termed anabolic exercise has been shown to be very effective in a wide range of diseases. The same applies to cancer, and there's a number of studies now which have demonstrated very strong efficacy for resistance training. We're recommending 2 to 3 sessions per week. Leave at least 1 day between sessions for you to recover. And we're looking at a set of between 8 and 12 repetitions over the first 2 weeks, gradually progressing to 3 to 4 sets of each exercise at a load of 6 to 10 repetition maximum for 6 to 9 functional exercises. When I talk about repetition maximum, and I want to reiterate this, it must be a level of intensity where you are trying hard to actually lift that weight. And what we mean by a 6 RM load is that you lift the weight and it's 4, 5, and number 6 is hard because it's then when you stimulate the muscle and the bone to grow and to get stronger and to improve. This anabolic exercise, this term, very, very appropriate for resistance training. It's a bit of a marketing exercise. Instead of talking about weightlifting and resistance training, we're now calling it anabolic exercise because that's the effect we're trying to induce. We're trying to get those muscles and bone to grow and to be stronger, for you to increase your level of function. And when you do anabolic exercise, you get lots of lovely hormones released, which make you feel better, happier, and improve your quality of life. So why anabolic exercise for cancer patients? More and more literature comes out every month showing consistent and large improvements in neuromuscular function of cancer patients if they lift weights. It retards or reverses the age and disease-related sarcopenia or muscle loss and the osteopenia or bone loss that occurs. It alleviates many of the symptoms of cancer and its treatments. We believe it's a very important adjuvant treatment. Now, I'm not saying give up or don't take up your chemo or radiation therapy. By all means, please don't take that message home. We see that physical exercise will support those other medical therapies that you're undergoing. It's better tolerated than aerobic exercise. With our cancer patients, we're finding that it's difficult for them to get out and walk, for example, because to get the same benefit, you've got to walk for a long time, you know, an hour every single day. It's a lot of commitment. But resistance training, you really only need to perform it 3 times per week for perhaps 40 minutes. So it's much more manageable, particularly trying to work it into an overall fatigue management program. Some design recommendations for these exercise programs. Progression is important. As you become stronger, you have to lift heavier weights, so go out and get your dumbbells, and as they become easy, you give them to your kids, or your grandmother if you like. That'd be good as well. She needs to lift weights. And then go down to your local sports store or Big W and buy yourself a heavier set. It has to progress. It has to be of adequate intensity. This is not about your light exercise, your happy little lifting weights in the community centre, okay, nice and gentle exercise. This is about making a hard training commitment to fight this disease, to overcome it, and to reduce the side effects that occur. Periodise. This is a term that we use constantly with athletes. The program changes continuously. It needs to change with the patient as well. You have heavy and light days. You change the exercises. You change the duration of exercise. It changes continuously. And that is what continues to make the body respond and adapt. Exercise for functional improvement is important. Choose exercises that will help you in your tasks of daily living. Sufficient recovery between exercise sessions. It will take longer than when you were before you were diagnosed, because you have the disease itself and also the treatments which are impacting on your immune system's ability to recover from an exercise bout. So allow yourself a little bit more time. Planned within your fatigue management program. Make it a part of it. Integrated with, we have a later speaker after me who's going to speak to some of these areas, but it has to work in with relaxation, flexibility exercise, nutritional aspects of lifestyle, meditation. And it has to be specific to cancer and its comorbidities. I was very excited in August when a very important series of articles were published in the Journal of Clinical Oncology. So I'm calling this Stop Press. However, it's probably, now we're into September, it's probably getting a little bit late. It's getting old news, but it's important news, and I really want to get it out there for you. This was published in the Journal of Clinical Oncology last month, and the title is Cancer Survival, Time to Get Moving, Data Accumulated Suggesting a Link Between Physical Activity and Cancer Survival. That was the editorial. 2 key papers have recently shown a 50 to 60% increase in survivorship. These are large prospective studies in colorectal cancer by Mayhart and others, and they show a considerable improvement in people who either maintain their physical exercise or actually increase their amount of physical activity during their cancer and its treatment. Now, they're using what is called 9 to 18 plus MET hours per week for 4 to 5 sessions. What does this mean? Well, this is getting out and walking or some form of vigorous exercise for between 30 and 60 minutes, 4 to 5 times per week. That's considerably less than what we're recommending, and yet we're showing a 50 to 60% increase in survivorship. We would expect, based on our research and that of other teams, that the effect of a combination of aerobic exercise, resistance or anabolic exercise would have that effect or even higher. Very, very encouraging results. This is a quote from that article. Such an effect parallels that of one of the leading treatments for cancer. An agent heralded by the oncological care community and by the director of the National Cancer Institute, Andrew C. von Eschenbach, MD, as a major advance and turning point in eliminating suffering and death from cancer. So that is the equivalent effect that we are receiving with physical exercise. Launching on a physical exercise program, particularly if you have been fairly inactive for most of your life, can be difficult. You need help and assistance with that. There are professionals in the community. The most recognised allied healthcare professional for the prescription of physical exercise is the exercise physiologist. These are accredited through the Australian Association of Exercise and Sports Science, or ACE, and you can see the website there. There is a facility there to search before an exercise physiologist. But these are people who are a minimum of 4 years university trained specifically in exercise prescription and management. They have extensive experience, particularly dealing with chronic disease populations. They are certified. And as of the 1st of January this year, a major change in legislation with regard to Medicare. You are now covered for up to 5 sessions if that exercise physiologist is involved as part of an enhanced care plan. And so I really encourage you to take advantage of that to get some expert advice on your exercise program, and then to take that program up and to pursue it, to train like an athlete, to train like the Swans obviously trained last night, to beat the Dockers, which I'm not bitter about. But that's the fight that's on. You've got a lot of things going on in your life, and it is important to look at physical exercise because of the very, very positive benefits that you experience from that, the quality of life improvement. And we now know that in colorectal cancer, and I am sure based on the physiology of exercise, this applies to all cancers, your chances of survivorship will be greatly enhanced if you embrace physical exercise. Thank you.
Thank you very much, Rob. It was good to hear that your, I guess one of the positives that came out of the diagnosis and suffering of your father was your motivation to study this area. And I think your passion and vision will help many patients. Certainly there has been some work in breast cancer as well on weight loss and exercise showing a survival benefit. I'd just like to remind people about the telephone numbers. The telephone number is 1800 062 277, 1800 062 277. Our fax line, and please don't call this line, is 02 9845 7117. And just a reminder, just give your questions for Rob to the coordinators now. Our next speaker is Dr. Craig Hassard. Craig is a general practitioner and senior lecturer at the Monash University Department of General Practice in Victoria. Craig teaches at both undergraduate and postgraduate levels. His main areas of interest in teaching and clinical work are in stress management, meditation, mind-body medicine, health promotion and counselling. Craig also teaches at the Gawler Foundation, cancer residential programs and the Petrea King Quest for Life Centre. Craig has written 3 books and regularly presents on radio discussing holistic health issues. Craig's topic today is traditional and complementary nutritional management. Thank you very much. Welcome.